lung cancer, wasn't it?
Hmm.
And you were telling me that you were losing some weight over that time?
Yeah, I've been, the weight has been going down all the time over the last 2.5 years since I had the operation. And I've got a dietitian who has been very good to me. She asks me what I eat and things like that, and I'm eating everything that I should eat. And then that to one side, I got the pain in my ribs, and I went to the doctors with it. He sent me for X-ray, which didn't show anything. He gave me antibiotics and it cleared it up. Still get this pain, which I know what it is now, but it's not a pain that, it's a discomfort more than a pain.
Yes.
And then just recently, over the last couple of months, I was having problems with my breathing. And I went to the doctors again. They sent me for an X-ray. That didn't show anything out of the ordinary. She put me on antibiotics and steroids, things, and sent me to see a specialist
At the Glenfield.
at the Glenfield, who was a breathing specialist, and then they did tests on my breathing and asthma tests. He changed my inhalers, because I have asthma, to a stronger inhaler. And then he said, I'm going to send you for a CT scan, see if we can see anything deeper than we know of. And then after taking these new inhalers and the antibiotics I was on, I felt better than I was before. Before I even got this chest pain.
Yes, it improved things.
I was improving a hell of a lot, and then I went for the CT scan, and I went to see him, and he says, I'm sorry to say, but you've got a lung cancer. It was very outspoken, which I like. I'd rather have that than beat about the bush.
You prefer a clinician to be direct and tell you the kind of truth straight away?
Yeah. I says, I'm referring you now back to Osborne House.
Building for the oncology treatment.
Oncology, which I know about. I mean, I've been there before to see Professor Thomas.
And given that's so recent, how far has the treatment got? How far have you got in the...
It hasn't started yet. I'm expecting a letter. It was only last week.
Yes, so you're actually still waiting for the
I went to see Professor Thomas last Tuesday.
Yeah.
And she said you should, well, it wasn't her, it was one of her doctors I saw. I should hear something within the next week or 2 weeks, which is now coming up to 2 weeks. And they're going to do 8 sessions of chemotherapy.
Yes.
That's the only way that they can do it. You go in the hospital, you spend half a day there in the chair and having your stuff pumped in,
drugs, yeah.
which I've gone through. I know all about that. And then you come home and you have 2 tablets a day, one in the morning, one at night, for 21 days. Then you start the cycle again, and you've got this for 8 sessions.
How do you feel about the chemotherapy overall?
Well, I had 2 sessions of chemotherapy before, which didn't affect me in any way. So it's not bothering me. But to do 8 sessions, is it
We'll have to see, won't we? Because
Well,
it might be. It's a different drug this time.
it is a different drug,
Yeah.
and she's explained all this to me. But I'd rather have the discomfort and everything. If I can get another couple of years out of my life, I'm going to be a happy bunny.
So you're saying you'd rather kind of put up with the discomfort
Yeah.
now if you can have the positive benefit
Yeah.
that accrues with time, which makes a lot of sense.
She told me that it wouldn't cure the cancer,
Yeah.
but it'll shrink it and give you more time.
Yes. I understand. It improves your outlook in a way
Yeah.
without giving you a total cure. It causes the cancer to be less aggressive, if you like.
Yeah. Yeah.